Hello friends, welcome to our channel. In today's video we are going to continue the topic of semisolid dosage form. Contents to be covered in this video are classification of semisolid dosage form and the mechanism and factors influencing dermal penetration of drugs. So let's start. First, classification. Semisolid dosage forms can be classified based on various criteria, including their physical characteristics, intended use, and composition. Here's a general classification of semisolid dosage forms. First, based on physical characteristics. A. Creams. Creams are semisolid emulsions containing water and oil phases. They are typically easy to spread, have a lighter texture, and are absorbed relatively quickly into the skin. Creams can be used for various dermatological conditions and cosmetic purposes. B. Ointments. Ointments are semisolid preparations that have a higher proportion of oil and may also contain water. They have a thicker consistency compared to creams and provide longer-lasting moisturization. Ointments are often used for wound healing, dry skin conditions, and protecting the skin's surface. C. Gels. Gels are semisolid systems that contain a gelling agent to provide a unique texture and improve adherence to the skin. They can deliver active ingredients evenly and are commonly used for delivering medications, such as pain relief gels or acne treatment gels. D. Pastes. Pastes are thick semisolid preparations that contain a high proportion of solid materials. They are often used to provide a protective barrier, such as in wound care or in treating skin conditions like diaper rash. Second, based on intended use. Under this, A. Topical semisolid dosage forms. These are applied to the skin's surface or mucous membranes for localized effects. They include creams, ointments, gels, pastes, and lotions used for dermatological conditions, wound care, pain relief, and cosmetic purposes. B. Transdermal patches. While not strictly semisolid, transdermal patches fall into the category of controlled release dosage forms. These adhesive patches deliver drugs through the skin and into the bloodstream over an extended period. C. Rectal and vaginal suppositories. These semisolid formulations are designed for rectal or vaginal administration, delivering medication locally to the lower digestive tract or vaginal canal. Third, based on composition. Under this, A. Oil in water emulsions. These semisolid formulations have water as the continuous phase and oil droplets dispersed within it. Creams are often formulated as oil-water emulsions. B. Water in oil emulsions. In these formulations, oil is the continuous phase, and water droplets are dispersed within it. Ointments are commonly formulated as water-oil emulsions. C. Hydrogels. Hydrogels are semisolid formulations containing a high proportion of water. They are capable of holding water while maintaining their semisolid consistency, making them suitable for applications requiring hydration and drug delivery. D. Non-emulsified formulations. Some semisolid preparations, like pastes and poultices, do not rely on emulsification but rather on the mixture of various solid and liquid components to achieve the desired consistency. Now, mechanism and factors influencing dermal penetration of drugs. The dermal penetration of drugs refers to the process by which a drug's active ingredients are absorbed through the skin and enter the systemic circulation or exert their effects locally. This process involves various mechanisms and factors that influence how effectively and efficiently drugs can penetrate the skin barrier. Here's an overview. First, mechanisms of dermal penetration. This involves, first, passive diffusion. This is the most common mechanism of dermal drug penetration. It involves the movement of drug molecules from an area of higher concentration, usually the formulation applied to the skin, to an area of lower concentration, deeper layers of the skin and bloodstream, across the lipid-rich stratum corneum, outermost layer of the skin. Second, transappendigeal route. Hair follicles and sweat glands can act as pathways for drug penetration. Drugs can diffuse through these structures, which can increase the surface area available for absorption. Third, iontophoresis. In this method, An electrical current is applied to the skin, promoting the movement of charged drug molecules across the skin barrier. This technique is commonly used in medical settings to enhance drug delivery. Fourth, microneedles. Microneedles are tiny, painless needles that can create microscopic channels in the stratum corneum, allowing drugs to penetrate the skin more effectively. Second, factors influencing dermal penetration. This involve, first, physiochemical properties of the drug. Following are the physiochemical properties. A. Molecular size. Smaller molecules tend to penetrate the skin more readily than larger ones. B. Lipophilicity, oil solubility. Lipophilic drugs have an easier time passing through the lipid-rich stratum corneum. C. Hydrophilicity, water solubility. Hydrophilic drugs may have difficulty penetrating the hydrophobic stratum corneum. Second, formulation factors. This include A. Vehicle, base, the type of formulation, cream, ointment, gel, and the excipients used can impact drug release and skin penetration. B. Penetration enhancers. Certain excipients can disrupt the skin barrier, enhancing drug penetration. Examples include oleic acid and propylene glycol. Third, skin barrier integrity. This involves A. Intactness. The condition of the skin barrier affects drug penetration. Damaged or compromised skin, e.g., cuts, burns, allows for easier drug passage. B. Thickness. Thinner areas of skin, such as the face, may allow for greater drug penetration compared to thicker areas. Fourth, skin hydration. Moist skin can have increased permeability due to the swelling of the stratum corneum, facilitating drug diffusion. Fifth, anatomical site. Different areas of the body have varying levels of skin thickness, hair follicle density, and sebaceous gland activity, which can affect drug penetration. Sixth, duration of contact. Longer contact time between the drug formulation and the skin can increase drug absorption. Seventh, drug concentration. Higher drug concentrations in the formulation can lead to increased drug penetration through passive diffusion. Eighth, temperature. Higher temperatures can increase skin permeability due to vasodilation and increased blood flow. Ninth, pH and ionization. The pH of the formulation and skin can influence drug ionization, which, in turn, affects penetration. 10th, individual variability. Factors such as age, gender, ethnicity, and genetics can lead to variations in skin permeability and drug penetration. Now the last topic of this video is excipients used in semi-solid dosage form. Excipients are inactive ingredients used in pharmaceutical formulations to aid in the manufacturing process, improve stability, enhance drug delivery, and ensure the desired properties of the final product. In semisolid dosage forms, such as ointments, creams, pastes, and gels, excipients play a crucial role in determining the texture, viscosity, consistency, and overall performance of the product. Here are some common excipients used in semisolid dosage forms along with examples. First, emulsifiers. Purpose: emulsifiers help blend oil and water phases in emulsion-based semisolid formulations like creams and lotions. Examples: cetyl alcohol, stearyl alcohol, sorbitol stearate, span, polysorbate 80, tween, glyceryl monostearate. Second, thickeners and stabilizers. Purpose: thickeners and stabilizers enhance the viscosity and stability of the formulation, preventing phase separation and providing a consistent texture. Examples: carbomer, hydroxyethyl cellulose, HEC, xanthan gum, guar gum, sodium alginate. Third, humectants. Purpose: humectants retain moisture and prevent drying of the formulation, ensuring its stability and maintaining a desirable texture. Examples: glycerin, propylene glycol, sorbitol, polyethylene glycol, PEG. Fourth, preservatives. Purpose: preservatives prevent the growth of microorganisms and extend the shelf life of the semisolid product. Examples: methylparaben, propylparaben, benzyl alcohol, phenoxyethanol. Fifth, solvents and co-solvents. Purpose: Solvents and co-solvents help dissolve active ingredients, enhancing their solubility and improving formulation uniformity. Examples: ethanol, isopropyl alcohol, propylene glycol. 6th. Antioxidants. Purpose: antioxidants protect the formulation and active ingredients from oxidative degradation, preserving their efficacy and stability. Examples: vitamin E, tocopherol, ascorbic acid, butylated hydroxytoluene, BHT, butylated hydroxyanisole, BHA. 7th. Surfactants. Purpose: surfactants aid in emulsion formation, solubilization of active ingredients, and improvement of spreadability. Examples: sodium lauryl sulfate, polysorbate 20, lecithin. 8th. Colorants. Purpose: colorants are used to impart a specific color to the semisolid dosage form for identification or aesthetic purposes. Examples: FD&C dyes, natural colorants. 9th. Fragrances. Purpose: fragrances are added to improve the sensory experience of the product and mask any unpleasant odors. Examples: various essential oils, synthetic fragrances. 10th. Chelating agents. Purpose: chelating agents are used to bind and inactivate metal ions that could catalyze degradation or destabilization of the formulation. Examples: EDTA, ethylene diaminotetraacetic acid, citric acid. Note: these are just a few examples of the many excipients used in semisolid dosage forms. The choice of excipients depends on factors such as the specific formulation requirements, the intended use of the product, and regulatory considerations. Thanks for watching. If this video was helpful, then please subscribe the channel and hit the bell icon so you get our notification. Thank you.